You are young, you are fit, you have never had a health problem in your life, and then suddenly, out of nowhere, a sharp stabbing pain hits one side of your chest. Every breath makes it worse. Your chest starts to tighten. You cannot get enough air. What is happening to you? You could have a pneumothorax, and you need to be in an emergency department right now. Your lungs sit inside your chest wall like two balloons inside a sealed box. Normally, there is no air in the space between the lung and the chest wall, just a vacuum that holds the lung fully inflated. A pneumothorax happens when air leaks into that space, the vacuum is broken, and the lung begins to collapse. The affected side cannot expand properly. Every breath in pulls against the leak. The pain is sharp, stabbing, and gets worse with every single breath. We call this pleuritic chest pain, and as the lung collapses further, breathlessness and chest tightness follow rapidly. Here is what surprises most people. This condition does not mainly affect the elderly or the sick. Pneumothorax most commonly strikes young, fit, healthy people. Often tall, slim men in their 20s and 30s, with no warning and no obvious cause. It can also happen after an injury to the chest or certain medical procedures. But the classic patient is young, healthy, and had absolutely no idea this could happen to them. We confirm the diagnosis with a chest X-ray and sometimes a CT scan. Treatment depends entirely on how big the pneumothorax is and how unwell you are. A small pneumothorax can be managed conservatively, monitored, observed, and allowed to resolve on its own. However, if the pneumothorax is large, or if your oxygen levels are dropping, we intervene immediately. The first step is needle aspiration, a needle inserted into the chest to suck the air out. If that is not enough, we insert an intercostal chest drain, a tube placed into the chest wall that continuously drains the air and allows the lung to re-expand, like the one you can see right here. Once the emergency is managed and your lung is re-expanding, you will be referred to a pulmonologist, a lung specialist, for further investigation and follow-up. They will assess why it happened, whether it is likely to happen again, and whether any further procedures or surgery, like pleurodesis, are needed to permanently seal the space. Now, this is critical. If you have been diagnosed with a pneumothorax, there are two things you must not do until your specialist has given you the all clear. These are not suggestions. These are medical instructions that could save your life. Number 1, no scuba diving, ever, until formally cleared. The pressure changes underwater could be fatal. Number 2, no flying. Air travel must be avoided until the pneumothorax has fully resolved, because the change in cabin pressure at altitude can cause the pneumothorax to dramatically worsen. Pneumothorax can be frightening, a sudden pain, struggling to breathe, no warning. But with fast diagnosis and the right treatment, most patients recover fully and go on to live completely normal lives. If you ever feel that sudden, sharp, one-sided chest pain that gets worse with every breath, do not wait, do not drive yourself, call for an ambulance, get to the emergency department. We know exactly what to do, you are not forgotten.